Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to today's news conference for the latest in COVID-19 information for the Amarillo community. Let me go ahead and briefly introduce who is on our panel today. We are joined by Amarillo Mayor Ginger Nelson, Casey Stoughton, Public Health Department Director for the City of Amarillo, Dr. Scott Milton, Public Health Authority, University Health Sciences Center, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Lementier, Chief Medical Officer for BSA, Rodney Gonzalez, Director of the Amarillo VA, and City Manager. Up to some statements from our panel members, and then we'll questions from the media who are in attendance. Mayor Nelson, we'll start with you. How are you?
I'm well, Dave. Thank you. And hello, Amarillo. Vaccines are still the most important thing that we're doing to respond to COVID-19. And our clinic at the city is open, but there are other places in the city that you can get a vaccine as well. There are numerous providers, and different types of vaccines are available at different providers. So I just want to encourage you as a citizen, if you haven't stopped or created a space in your schedule to get a vaccine, let's make that a priority. And the more people that we get vaccinated, then the safer we are as a city, but also the more productive we are as a city, because now we're beginning to see folks, as our masks are coming off and we're loosening protocols some, we are beginning to see a rise in exposures again. And when you are exposed, then protocol is that you have to be quarantined. And so many of us work jobs that we need those jobs to pay the rent and buy groceries. And so protect yourself from that quarantine situation by getting a vaccine. There's no cost for a vaccine. There's hardly any wait. And I'm talking to many people about it and have seen no adverse reactions on as far as long-term anything. It's safe to get a vaccine. Maybe your arm was sore. Mine was sore for a couple of days. You might have had a low fever, but all of that is minimal compared to getting COVID. When I had COVID, I was sick for over 12 days. So I think it's important to remind people that prevention through the vaccine is good for you. It's good for your health, but it's also good for your personal budget, because that's time you won't be taking off from work. It's good for your business. It's time you won't be taking away from that business. And when you add all of that up across the whole of our city, it makes our city safer, and it builds our economy and makes our economy stronger. So there's the big pitch today to get your vaccine. And if you've done that, then I'm asking you just to continue to encourage your family, your friends, your neighbors. Out of love, ask them, have you scheduled your vaccine? And let's see if we can't make a push to continue vaccinating people in our city. I appreciate that you're checking AmarilloAlerts.com for information about when the city clinic is open. We will begin to see some shifts, not immediately. We're definitely going to talk to you about those as they come, but we will begin changing and trying to do clinics at various locations across the city in the coming weeks. So just stay tuned for all of that. The name of this COVID game, as well as the vaccines, has been adapt, adapt, adapt. So those clinics will continue to adapt to meet the needs of people who have not been vaccinated yet. I also just want to give a shout out to every face that's on this call every week. This week, the Better Business Bureau came out with their Excellence in Community Service Awards. And every single one of you received an Excellence in Community Service Award. Dr. Gonzalez, Dr. Milton, Dr. Lementier, Dr. Weiss, Casey, Jared Miller. I'm so proud of the work that you've done for our community. And I just wanted to point that out to the folks that are watching, that even the Better Business Bureau sees the effect that you've had, your service time, and the way that you've taken care of our community. It does have a health impact, but it also has a business impact. And I'm really grateful that they can see the tie that those two things have together. And the last thing I want to say this morning is city elections are a week from Saturday. And so it might not be COVID related, but it is very important for our city. Early voting is open now. So hop on Facebook and find out where those polls are. in Potter and Randall County. There are multiple locations you can go and do early voting this week. You can early vote Monday and Tuesday of next week. This week, the polls are open 8 to 5. Next week, the early voting polls are open 7 to 7. And then the actual election day is Saturday, May 1st. But go vote early if you can. It's a good idea. That's all I have today, Dave. Thanks.
Thank you, Mayor. Let's now go to Casey Stoughton, Public Health Director for the City of Amarillo. Casey, how are you?
I'm well, Dave. So it's an exciting day here at the Civic Center today. During our clinic, the Civic Center team, who's always safety conscious, is testing their fire alarm system. So fire alarms go off, I'll just my microphone and we'll move on to the next speaker, because those fire alarms are loud and include strobe lights. So it has been an exciting day for us. So we'll talk about the numbers real quick, and then we'll talk more about Mayor Nelson talked about community clinics. And so that's very exciting for us. As of yesterday, there were a total of 33,744 cases of COVID-19 in Potter and Randall counties, 17,216 cases in Potter County, and 16,528 cases in Randall County. We have a total of 32,700 recoveries, and we do have 136 deaths to report as of yesterday. That leaves us with 236 active cases. At the 2:30 report card, there will be additional cases and recoveries, and we hope not additional deaths, but there definitely could be to report at the 2:30 report card. The 7-day rolling positivity rate is currently at 3%. The positivity rate at the drive-through testing site is at 6%, and the 5-day new case average is around 19 new cases per day. Yesterday, our GA34's hospitalization percentage was at 3.19%, and that means that just over 3% of all of our hospitalized patients have COVID-19. That has gone up just a little bit. We're still under the 5% mark, but just want to make sure that we're watching that number, wearing our masks, socially distancing, protecting our hospital capacity and our hospital employees. We're also at status level yellow. The public health drive-through testing site remains operational, as does the vaccination clinic at the Amarillo Civic Center. We're at entrance 2 is the entrance that you will enter that clinic there at the Civic Center. Today, we will be open until 5 p.m. For other times, clinic times, and other information about COVID-19, like the mayor said, you can check out AmarilloAlerts.com. Lots of great information there. As a reminder, all adults are eligible for COVID-19 vaccines. So anybody that's 18 or over at the Civic Center Clinic, we have Moderna vaccine. So anybody 18 and over is eligible to be vaccinated, and we would love to provide you your vaccine. To date, we've given just over 72,474 first doses and 50,201 second doses, for a total of 123,675 doses given. We will later this week, we'll announce plans to provide mobile clinics as we finalize the details. We have a very successful clinic at the Civic Center, and we'll continue to offer vaccinations at the Civic Center on a walk-in basis, but are very, very excited to be offering vaccine in other parts of our community as well. So as those details are all finalized, we will provide that information later this week. So please stay tuned for more information. It's important that we're able to give the vaccine where you are, as well as being able to come to us. So please come and get your vaccine while we're here at the Civic Center. I know that the past year has been long, but I want to leave you with words of encouragement to not grow weary. Your efforts to mask and social distance and practice good hand washing, although we should really always wash our hands, and other efforts to curb the spread of COVID are still important. So you're still important, so please keep up your efforts. And that's all I have, Dave.
Thank you, Casey. Let's now go to Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center. Dr. Milton, how are you?
Good, Dave. Thank you. Just a few brief comments about the numbers. You know, if everyone remembers, we peaked at the number of active cases back in late November. I think it was well north of 8,000 active cases. And I think, and Casey, maybe if you could correct me, but we nadered more recently and maybe 2 or 3 weeks ago at less than 200, around 180. I just noticed today there was 263 active cases. So obviously we've been in much worse shape, but we're watching these numbers slowly creep up. And so I just want to make sure everybody's aware that when we look at these numbers, clearly this means that this is still circulating in our community. And it's very important to do these things that we've talked about many times. The most important of which I think is to get vaccinated. We have plenty of vaccine available, and I'm encouraging everyone to get out there and get vaccinated, especially those that are most vulnerable. And we've talked about that many times, those that are elderly or have chronic medical conditions. I try to encourage all my patients to do that. So please keep that in mind and go get vaccinated. That's all I have, Dave.
Thank you, Dr. Milton. Let's now go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Weiss, how are you?
Good morning, Dave. Well, I'm vaccinated and I'm happier about that every day. So, we were on a call like this about a week or two ago, and we had a special guest on, and they finally asked, well, what is a variant? And we realized that we throw that term around all the time, and maybe a lot of people don't really understand what that means. So remember, a variant is the same as a mutation. And what that means is that the virus has changed part of its genetic material that then produces a change in the structure or the appearance of the virus. So that's what a variant is. Now, if you remember the Pfizer and Moderna vaccines, they give our bodies a message on how to make a single very important protein of this virus called the spike protein so that our immune systems will recognize it. Now, when a protein is made, it folds into a very complicated structure. So when the immune system is trying to look at how do I recognize this protein next time and raise antibodies, it picks little tiny parts of that protein. And it may be a particular fold or a particular twist on the surface of that protein to raise antibodies against. The problem is if you get a variant, so now that corner that the immune system used to raise an antibody now gets tucked into the inner part of the protein, then those antibodies can't recognize that protein anymore. And so the immune system is defeated. So that is our worry about these variants is the antibodies that we raise, will they be defeated by the fact that the virus changes the structure of the protein, and now that part of the protein is no longer exposed where the antibody is identified. So if you look in Michigan right now, they're saying Michigan is seeing a rapid rise in cases, and they're saying that over 75% of the virus in Michigan is the UK variant. Now we know that's a much more contagious variant. We even know it's more fatal, but we also do believe that the vaccine does recognize that UK variant. Now that's not necessarily true for the South African variant. We're concerned that the structure of the protein on the surface has changed enough that these antibodies don't recognize it. Right now, there are over 60 variants described worldwide. So this is critical because the more that we can get vaccinated and the less we can let this virus reproduce, the less mutations it can produce and get around these vaccines. So again, all the more important why we're in this race to vaccinate everybody to try to get a good step ahead of this virus as it continues to try to mutate. Let's talk about the numbers in Northwest. So we are at 10, we have 10 positive patients with COVID right now. That's 2% of our licensed beds. That is out of a total of 216 patients in the acute care hospital. And that's a pretty good number for us in terms of our capacity. Right now, we have 32 patients in our critical care units. 6 of those patients are infected with COVID-19. And now the 11 ventilators we're using right now, 3 of them are being used for patients with COVID. So numbers are looking a lot better. In terms of our outpatient testing, yesterday we had 5% of our outpatient tests were positive for COVID. Now, that's huge because, again, we were up 35 to 40% back in November and December. We've been down to as low as 1 to 2%. As Dr. Milton indicated, we're seeing a gradual increase to where we've been at 4 to 5% over the last week. Now, the interesting thing about some of our outpatient testing is I've seen a number of patients who got vaccinated are coming in feeling terrible. And when we test them, we're starting to see the rise of the old suspects, rhinovirus, some of the old traditional coronaviruses. These are the viruses we normally see this time of year causing colds. And guess what? As we reduce our mask use and reduce some of our restrictions, we're seeing the old suspects come back with a vengeance. And there's a rhinovirus that people are getting actually makes them pretty miserable for about a week. So again, I think a lot of that protective stuff that we've been doing has helped prevent some of these other viruses. We hit a real landmark today at Northwest. we have 0 employees quarantined as of today. So that's huge for us. And then unfortunately, we've had 2 deaths this month, which is way better than we've been, but unfortunately, it's 2 people that lost their life to COVID. Regarding to remdesivir, that's the inpatient drug where we treated 757 patients with that. We currently have 2 on treatment. And then we have bamlanivimab, which is that outpatient antibody we've been given. Interesting. Last Friday, the FDA said, do not use bamlanivimab alone anymore. And why is that? For exactly the reason I talked about earlier, which is these variants have now made this antibody unable to see some of these viruses and some of these. So what they're telling us is if you're going to use bamlanivimab, you must combine it with a second antibody and give it as a cocktail. So we are now obtaining that second antibody, and we'll have that available for anyone as an outpatient who meets the criteria for bamlanivimab. And lastly, in the next week, we will be completely free of any of the RAC-associated staff that we've had visiting us for many, many months. So we'll be totally dependent on our own employed staff as of the end of April. I would say that a lot of people have heard about the J&J vaccine concerns, and I would ask that please give the scientists and the physicians time to really determine as to whether or not there's a concern there. But what I want to tell you is what an amazing surveillance system we have that we detected 6 clots out of 7 million vaccines. Unbelievable. I think that makes me feel safer because if you look at Moderna and Pfizer, we've seen no concerns out of the same surveillance system. So please, I'd reaffirm what the mayor has said, what Casey has said, what Dr. Milton said. I'm sure what Dr. Lamentier and Dr. Gonzalez are going to say, which is please get vaccinated. We know they're safe. We know they're effective, and we got to get ahead of these variants. Thank you. That's all I got today.
Thank you, Dr. Weiss. Let's now go to Dr. Michael Lamentier, Chief Medical Officer for BSA. Dr. Lamentier, how are you?
I'm good, David. Thank you. And good morning, Amarillo. And thanks to the panel for the comments that came ahead of me. I think that we really are in a situation now where we have to be careful. And I think we have to be careful because there's kind of a dichotomy that we're experiencing here. And that is that we have this portion of our population who's been vaccinated. And it really has a level of protection against future infection that we believe is significant. We also have in that, I would say somewhat in that category, individuals who have been previously infected and not vaccinated, although not to the same degree of protection we believe as those who are vaccinated. Potentially those who have been infected and received at least 1 dose of the vaccination thereafter may be being in the best position in terms of the level of immunity that they have. And then we have some individuals that have not been vaccinated for various reasons. A very small percentage of individuals can't be vaccinated, potentially. And we're going to say there's going to be some legitimate reasons why they would not. Concern about anaphylaxis, things like that are legitimate reasons. There's going to be individuals that do not qualify under the EUA. And I would say that obviously one category are our adolescents below the age of 16 who are not yet approved to receive the vaccination. And also, for the most part, lower risk for having complications of COVID, but not zero risk. Let's remember that. And certainly not zero risk to transmit the virus to those in their family who could be elderly or immunosuppressed. And I think as we think about relinquishing some of the restrictions and relaxing some of the restrictions around masking and around social distancing, and as we're moving into the yellow phase that we've been in, there's really a distinction there. And I think that the level of comfort that individuals should have when they've been vaccinated is certainly different than when you've not been vaccinated. And again, I think that this is my commentary and my feedback, but I think it's important to note from a scientific standpoint, having no previous vaccination and no previous infection and relinquishing masking, social distancing, thorough hand washing is really a concerning arena right now. I'm advising our friends that reach out to me for advice, other individuals, patients that reach out, anyone who's asking about what really the concern should be moving forward. And the concern should be, are you going to get infected with COVID-19? Is it going to be one of these variants potentially? Is it going to be a strain that has the likelihood of causing more severe disease? And if you do get that type of infection, what is going to be your clinical course? Is it going to be fairly benign? You're going to recover? Or are you going to be someone who gets infected and is fortunate enough to survive, but has lingering symptomatology for weeks or months? Or are you going to be one of the most unfortunate that gets infected and succumbs to disease, whether or not you have an immunocompromised state or not? So I really think it's critical to think about your own station and again, reevaluate why you would not get vaccinated and attempt to use a scientific approach to making that determination. As Dr. Weiss mentioned, the press that came out this week about the Johnson & Johnson vaccine and the blood clots that occurred in a very small number of individuals out of nearly 7 million doses administered is a curiosity and absolutely requires further evaluation to determine if those individuals had a higher risk profile for getting blood clots, which we call thromboses in the medical terms. And these are blood clots that occurred in the venous system of the brain. Again, were those individuals predisposed because of medications they were on, because of some of their own genetic makeup? We don't know that yet, but we will find out. We do know about the AstraZeneca vaccine, which was not approved in the US, in terms of some of the potential antibody production that was incited, we believe, the scientists believe, by the vaccine, and that attacked some of the platelets that are the cells that clot blood in our body. And again, that mimics another syndrome we know that can be caused by another drug we use commonly called heparin. The complexities of all this are really something that we can talk about for hours, and we don't need to get into that right now. What we do need to make sure that people are understanding is that the messenger RNA vaccines and even the Johnson & Johnson vaccine have been shown to be highly safe and effective. And I think we're going to see revised recommendations coming out within the next couple of weeks for the Johnson & Johnson vaccine to be administered in those individuals that are not having a higher risk or propensity for blood clots. So again, just a little bit background on some of that data. As far as the BSA, today we have a total of 13 patients in the hospital with COVID-19. 7 of those patients are in our intensive care unit. 3 of those patients are on the ventilator. We have a high ICU census now, but that is because of non-COVID cases that are occupying a fair number of our ICU beds. We have a total of 300 patients in the hospital today that are admitted, and therefore the COVID census makes up about only 4% of that volume. I was looking back at some of our stats earlier this week in terms of this past year, and there was a point at which we had 55% of our inpatient census that was COVID positive. We don't want to get back there into that scenario. Obviously, none of us do as individuals in our community that are looking out for the well-being of our population. And hopefully, as we vaccinate more individuals, we're going to see the protection against that type of potential outcome with a resurgence of cases, which we hope does not happen. We're seeing our testing numbers really month to date in April, about 3.8% of all tests that we've done, inpatient and outpatient, are coming back positive. That's up a little bit from March, where we were at about 3.2% of all tests. We closed the month out. Back in February, we were around 5%. So better than we were overall. But again, a little bit of concerns about, are we having another slight uptick again? And again, we'll have to see how that pans out here over the next couple of weeks and months. We are down to only 36 of our RAC support staff still at BSA. Those are the nurses and therapists and techs that came to us graciously from the state to help with our COVID surge. And we're going to continue to demobilize those with the state's help probably over the next 10 days. I anticipate probably at the end of this month, we'll have close to 0 RAC staff. And that has been an outstanding degree of help that we've received, and we're very grateful for. To date, we have about 54% of our employees that have been vaccinated. We wish that number was higher. We're continuing to encourage our employees to get vaccinated. We're continuing to encourage our patients that come to our ambulatory clinics to get vaccinated. And as far as the monoclonal antibody therapy is concerned that Dr. Weiss mentioned, the FDA did revoke the monotherapy or single therapy with bamlanivimab this past week. And we had prior to that already switched at BSA to administering that drug with a second drug in a combination therapy. That is still recommended by the FDA and approved under an EUA, I should say, to be administered for individuals who are higher risk and have early symptoms of COVID. So you look at it now with those monoclonal antibodies as two options, either Regeneron, which is a combination of drugs that work as monoclonal antibodies, or the Bamlan with a second drug that is also similar to Regeneron in terms of having that two drugs in one therapy treatment option. And that is simply, I think, based upon what we're seeing in the literature and the reports that are coming out, a way to attack the mutant's ability to create a pathway around that therapy, if you will, and become resistant to a single drug being utilized. We see that with antibiotics and other treatments we use for other types of infectious organisms. So it's not surprising that we're seeing that with this, with the virus and the virus strains that we're trying to combat with these therapies. And the last thing I'll say is that individuals who have received those monoclonal antibody therapies, an extremely small percentage of those have ended up resulting in an infection that required a hospitalization thereafter. So it has remained an effective therapy. So again, much better than where we were. We're very encouraged that the city has done an outstanding job of helping to vaccinate a very large portion of our population. As Casey mentioned those numbers today, which are amazing. And I credit all of you who have worked to have that happen, and also the individuals who have stepped forward and received the vaccination. Let's continue to do our job with reassessing our individual situations and deciding why we would or would not get vaccinated. And hopefully we're moving forward with getting that done. Thank you very much.
Thank you, Dr. Lamentier. Let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
I'm doing well, David. Thank you. So first, I'm going to report on our hospital numbers. We currently have one inpatient with COVID positive, and that patient's in our ICU. As our positivity rate, that currently this month is less than 3%. In fact, this week it currently is at 1%. And so while those are two numbers I enjoy seeing low and I want to keep those down, there is another number that I would like to see grow, and that's our vaccination rate. Currently, the vaccination rate of the veterans that we serve within that are enrolled to the Amarillo VA healthcare system is at 36%. But we continue to have the Moderna vaccine available. And so would encourage veterans, veteran spouses, caregivers of veterans, if you want to be vaccinated, you can get vaccinated here at the VA. And I do know our community has many other sources for vaccinations. We offer the vaccination here at the Amarillo VA Monday through Friday. We do have a Saturday clinic this Saturday. Because we've seen some decreased demand, that will be our last Saturday clinic for now, and we'll continue to watch, but Monday through Friday, and we do it by appointment or by walk-in, either way. And then our Lubbock clinic also does it on Thursdays, does the vaccine. Now, as you know, in the past, I've mentioned that we had the Johnson & Johnson or Janssen vaccine, which is that single dose available. Obviously, when the FDA and the CDC recommended to put a pause on it, we did pause it. And so we are not currently giving any of that vaccine out. We await to see what further recommendations. It's my understanding the CDC and FDA will be meeting on Friday, and we look forward to any further guidance or recommendations that come out from that. And once we are ensured that it's safe to resume, we will resume it. But in the meantime, we continue to offer the Moderna vaccine to all those that would want it. Now, yesterday we had a ribbon cutting of our new CLC, which really doesn't seem like it has anything to do with COVID. And the CLC is our community living center. It's where our long-term care facility is for veterans. And so we have opened up a new wing of that. But I want to remind you, back in January, we actually were using that facility to do our COVID vaccinations. And so while we used it for a couple months to do COVID vaccinations, we are now had our official ribbon cutting to turn it over. And I look forward to, I believe our first veterans are going to be moving into there next week. And so very excited about that new improvement we were going to have in our center here. And the last thing I want to mention is this week is National Medical Laboratory Professionals Week. And, you know, we have all these things where we shout out to the staff, you know, our pharmacists, our nurses, our doctors, and respiratory therapists, and the many others that are making sure, well, you know, the laboratory is one of those that's behind the curtain. It's often something we forget about and we don't notice because they are behind the curtain doing the work. Yet they're the ones letting us know what is going on, giving us the test results, whether it be a COVID test, whether it be a blood chemistry test or other tests that we run on our patients to say, how are they doing? And so just want to give a shout out. We really appreciate all that they do in taking care of our patients. And so with that, I just want to thank the city of Amarillo for this opportunity to talk to my veterans.
Thank you, Dr. Gonzalez. Let's now go to City Manager Jared Miller. Mr. Miller, how are you today? You want to go to City Manager Jared Miller. Mr. Miller, how are you?
Recognize that I was muted. Thank you, Dave.
How are you?
I think I'd like to, doing good. Thank you, Dave. I'd like to build on the comments that the mayor said early on as she recognized this team and the recognition that was provided to us by the Better Business Bureau of the Panhandle, of the Texas Panhandle. At the very top of that list, and she didn't mention this person, but at the very top of that list is Mayor Nelson. So I did want to, and while that's very appreciated from the Better Business Bureau, I'm sure on behalf of every person here, I think it's important that we also recognize that she had a very key role in everything we've done on behalf of this team, but also on behalf of our community and the entire Panhandle. Did want to make note of that. If you have symptoms you feel might be coronavirus, our testing center, our drive-through testing center is still open. You can reach out to public health for an appointment, and they will refer you to the drive-through testing center if you call 378-6300. Also, if you need transportation to either the drive-through testing center or, more importantly, the vaccination site, you can call Amarillo City Transit at 378-3095. They will pick you up where you are. They will bring you to the vaccination site or the drive-through testing center, or the drive-through testing site rather, and they'll also take you back. It is as low barrier as we can possibly make it. We want to make sure that there's no obstacle that we can't reasonably address on your behalf to make sure that you can get vaccinated. It's very important. All the doctors have said the same. And I just wanted to add my non-doctor voice to that. From a logistical standpoint, we want to make sure that we can help you get vaccinated in any way that you need. We are still operating under GA34, the Governor's Executive Order GA34, that allows all of our businesses to be open at 100%, all of our facilities to be open at 100% of their allowed capacity. Face coverings are strongly encouraged in multiple locations of GA34 by the governor and by the DSHS. We are also want to note that businesses are allowed, and any property management, anybody that's responsible for a property can require face coverings inside their business or facility. I would ask that businesses that do that make sure and clearly communicate what your expectations are. I would ask of our citizens to honor those requests if you want to go into those facilities or do business there. And I would also ask all of us to have grace and patience and respect for those that we're around, because we all have different opinions on the face coverings. I would just ask that we all treat each other with respect as we navigate through this transitional period. Hopefully we're transitioning to a period where we are not having to worry as much because we are being vaccinated. We are being safer. We are better at sanitization. We're better at wearing our face coverings when we can't social distance and all of these things. Just want to make sure that we are respecting each other as we go through this transitional period. That's all I have, Dave. Thank you.
Thank you, Jared. We'll now go to members of our media who are in attendance. If you have a question for an individual panel member or the panel as a whole, that's completely fine. Let's go ahead and start with David Gay of the Amarillo Globe News. David, how are you?
I'm good. Good morning, everybody. I guess my first question is for the doctors in the room. Are there any updates on the number of the variant cases that you are seeing either at Northwest or at BSA?
David, I meant to look that up this morning. The last I heard is we had tested about 75 positives, sent them to the state lab, which I think then sends them to Utah or something like that. And we had 2 variants out of those 75. And I don't believe either of them was the UK or the South Africa. I believe they're both variants from the United States. So that's the last I've heard. It's just 2 out of 75.
And at BSA, we've sent a number of cases off for variant testing, and we have yet to confirm a case of variant disease here.
Okay. I guess my next question is for Casey. On, I believe it was Monday, the Public Health Department released a statement regarding numbers of duplicate cases as well as duplicate recoveries that were eliminated from Monday's report card. Can you give us a little bit of insight about how those duplications happened, and if the numbers that are currently being reported are those the accurate numbers without those duplicates?
Yeah, so the numbers reported today are the accurate numbers. We have a data entry system, and sometimes we have cases that are either reported to us or that are entered into that system, and maybe there's a slight misspelling of a name or a different spelling of a name, or some different, maybe somebody has a different address or some different variable in their demographic information. And so as we're moving through and doing quality assurance on all of our data, we had those that around 200 duplicates that we just wanted to make sure that we're always reporting the most accurate information that we have. And so we did clean those up and make sure that moving forward that we have that, and then we'll continue to do quality assurance. And if we have additional duplicates, then we'll certainly remove those, because we want to make sure that we're providing our community with the most accurate information.
Absolutely, absolutely. And how often, I guess, does that occur, that where individuals either check for duplicates or make sure that those aren't occurring?
So we have been doing that for quite some time. We do that, I would probably say, on a weekly or perhaps bi-weekly basis. We had those that had been working on those for a little while, and as we move forward, then there certainly won't be that many.
Absolutely, absolutely. And I guess the last thing that I want to cover is I know that I believe it was you, Casey, who said that the details of the mobile clinics are still being ironed out. Can you talk to me a little bit about the process of how these locations of the mobile clinics will be chosen, and if any of these locations have been chosen yet?
Yeah, that's a great question. So we're working with community partners to make sure that that we're providing clinics in locations that are most convenient for our community and for patients who need vaccine. And so we have worked with several different community partners, but we need to finalize the schedule so that we have that worked out, so that we can communicate that schedule all at one time to everybody, so everybody knows where we're going to be and when. Still offer clinic at the Civic Center, because that's very important that we have a very established location where people can walk in and be vaccinated. And so we will still have the clinic at the Civic Center, but we'll also add in additional mobile clinics around the community. So just additional options.
Absolutely. And with the establishment of these mobile clinics, my guess, and please correct me if I'm wrong, the clinic at the Civic Center will have to be scaled down in some way, shape, or form.
Yeah, just a little bit. So not a lot. We'll scale back just a little bit so that we can accommodate for the mobile community clinics, but we won't have to scale back a lot. And so that's nice. There'll still be plenty of opportunity to be vaccinated at the Civic Center. But so please come and be vaccinated. We want every opportunity for people to have their vaccine. If you haven't had it, if you haven't had an opportunity to be vaccinated, why don't you go vote, stop by the Civic Center and be vaccinated. Make a day out of it. All of your civic duties in one afternoon. I think we have stickers, so you could have your I voted sticker and your I got my vaccine sticker, and you could put those in your baby book or wherever you put your special stickers. And so I think that we could certainly make an afternoon of it. And but then we'll scale back just just a little bit here at the Civic Center, but also offer those mobile clinics for convenience.
Absolutely. And just one more follow-up. It'll still be the Moderna vaccine, whatever the city gets from the state, correct, for these mobile clinics?
Yes. Yeah, we have the Moderna vaccine. That's what we'll offer.
Perfect. That's all the questions I have. Have a great rest of your week, y'all.
Thank you, David. Let's now go to Aaron Langston of KAMR Channel 4. Aaron, how are you today?
Pretty good. How are y'all?
Good.
First question is, we're hearing about a possibility of a South Texas or Central Texas variant, I guess, becoming a thing, and just wanted to see, since that is closer to home for us than the UK and South Africa and some of the others, is there concern going forward with that possible?
Go ahead.
I'd say there's concern about every variant, but I don't want to be outdone by South Texas. We need an Amarillo variant, so we'll try to avoid that. But yeah, but yeah, every variant is a problem because again, we just don't know whether or not it's going to have that magical fold that gets around the antibodies generated by the vaccine. So hopefully we won't be bothered by the South Texas variant.
All righty. And we're hearing about possibility of, escalating exposures at schools, especially with the two major districts here in the Amarillo metro area making mask optional. Is that something you're seeing with numbers coming in?
Yeah, so we're working with each of the school districts on their cases and quarantines. I think it's important to note that anytime you're not wearing masks in large groups, that's certainly a possibility. But we're definitely working with all of the school districts on their cases and quarantines.
And then have you all seen an increase from the schools or from students and staff?
In some locations we have, yes.
All right. And let me see. Yes, the homebound vaccinations that we've talked about a couple times before. How's that process going? Do we have numbers as to how many people have been vaccinated and stuff like that?
Yes, I do. So we visited 110 homes. And we gave 231 first doses and 5 second doses. We've already started to go back and do the second doses for those first doses given, but we've visited 236 patients in 110 homes. And we also visited 5 senior living apartments or group, apartment complexes. And that was over 28 days. And so we could not appreciate our team more. That was part of the fire department. We had, fire department staff and public health staff. And so we really appreciate the work that they did. Oh, and we also partnered with Meals on Wheels and the Area Agency on Aging. And so it was really a team effort there. So couldn't appreciate that group more.
All righty. I think that has me covered. Thank you very much.
Thank you, Aaron. Let's now go to, I'm not sure who we have on here, anyone from KVII Channel 7. If you have a question, you may ask it now. Go right ahead. One more time, KVII Channel 7. If you have a question, you may ask it now. We'll go ahead and move on. I think we have Kevin Welch, AFBA News Channel 10. Kevin, how are you?
I'm good, Dave. Thanks. I guess, Casey, when you talked about 6% positivity rate on the drive-through, is it 6% out of how many tests? I'm trying to get a context there.
Sure. So that's out of the total tests that have been given for that time period, but it's that's a subset of the total positivity rate.
But do you know how many tests you're running at the mobile clinic now? About
not off the top of my head. I'd have to look at that, but we haven't. we haven't been super busy lately, but I
Mhm.
think traffic is picking up a little bit more.
Okay. And I guess, can you give us some examples of what these mobile clinics, what the location, what they might look like? What, is it a trailer? Is it at a church?
Yeah, so we will have our mobile clinic there, our big, the public health mobile clinic there, so that people know exactly where we are, but we'll be using different facilities so that we'll have adequate space to serve patients, so different locations around the city. And we'll have more information just as soon as we have all of the details and worked out and the dates that will be different places. So we'll give that to you just as soon as we have it.
Right. And Jared, I know this is still kind of a picture that's moving, but is there some kind of criteria for when it comes time to start phasing out the Civic Center clinic?
Yeah, we've got events in June. We're going to be shooting to, as we go through this transitional period and as usage of the vaccination clinic goes down, we will, and this part of this phasing is going to these mobile clinics and going out to the different quadrants of our city and providing vaccinations where people are, along with the homebound vaccination program as well. So they're all part of a process to start phasing into providing those services in more smaller locations. One, so that we can bring the vaccines to where people are, like I said, but two, we do have to start phasing into utilization of the Civic Center for what it's there for.
Okay. And Dr. Weiss and Dr. Lementier, the demographics of who's getting admitted to the hospital now for COVID, is that still similar to during the earlier peaks, or is it a little different?
Northwest, it's about the same. So we're still seeing kind of a span across ages. So it's still, the risk factors that we've identified remain the same as people who carry extra weight, typically people with diabetes, and older individuals are at greater risk, but still seeing it kind of across the board.
Yeah, and I would concur at BSA. It's very similar. The demographic is very similar to what it's been. I will say that very few individuals that have been vaccinated are showing up as the need for admission. And usually that's because they're in the early phase of the vaccination process where they haven't yet developed enough immunity because they're not beyond 2 weeks from the second dose of vaccination. And furthermore, the same thing holds for the employees that we are quarantining still. As Dr. Weiss mentioned, we're down at numbers 0 and 1 for each hospital, when before we had close to 100 employees or so quarantined at the previous peaks. The individuals that we're quarantining are those that have not been vaccinated.
Interesting. Okay, that's everything I have. Thank you all.
Thank you, Kevin. I want to go one last time. If anyone's there from KVII Channel 7, if you have a question, you may ask it now. Go right ahead. Hearing nothing, that will conclude today's news conference. I want to thank all of our panel members for being in attendance today, providing this information to the community. This is David Henry. I'm the Communications Manager for the City of Amarillo.